Okay. Welcome everybody to the HRB Primary Care Clinical Trials Network webinar series. This is the first webinar of the autumn series, and I'm Nikita Burke. I'm the new development officer, and I'm very much looking forward to working with you all. Today we have Elaine Toomey, who is a physiotherapist and postdoctoral researcher with the Health Behaviour Research Group at the School of Psychology at NUI Galway. She did her PhD at UCD and her bachelor's and master's at UL. Her research interests include health behaviour change, knowledge translation, behaviour clinical trials, chronic pain and obesity. And she's currently involved in the development of complex intervention to enhance feeding practices in primary care with the goal of improving childhood obesity outcomes. And that's what she's going to speak to us today about. She also works clinically part-time in a physiotherapy practice and was a visiting fellow in Ottawa in Ontario, Canada. Over the last couple of years, she was there twice. So thanks very much, Elaine. I'm going to hand over to you. I'm very much looking forward to your presentation. Thank you.
Thanks very much, Nikita. So I'm delighted to be here to chat to you all today. So as Nikita said, I'm a chartered physiotherapist and a postdoctoral researcher with the Health Behaviour Change Research Group in the School of Psychology here in NUI Galway. So basically, this is a webinar just to give you a brief overview. So I'm going to just do some introductions first in terms of introductions to the group and to the CHErIsH study. Then look at childhood obesity in Ireland as a problem in itself. Then looking at the role of infant feeding behaviours, more specifically in relation to childhood obesity. Then we'll take a look at the CHErIsH study, and then looking at future steps and potential for involvement. So by the end of this webinar, you should have an understanding of the problem of childhood obesity in Ireland, which most of you probably already do very well, but this really is just kind of giving an overview of that. Have an awareness of the role that infant feeding behaviours may play in the development of childhood obesity. And again, some people are probably very well aware of this, but just more of a snapshot into this. Have an awareness of the current infant feeding best practice recommendations and guidance, and an awareness of the Choosing Healthy Eating for Infant Health, or the CHErIsH study, and the potential ways that you can get involved with it, and that we would love to have you involved. So to kick us off, I'm just going to go through the background to the CHErIsH study and to the different people who are involved in it. So CHErIsH stands for Choosing Healthy Eating for Infant Health. It's been funded by the Health Research Board under their Interdisciplinary Capacity Enhancement Awards, or their ICE Awards. So originally it's really the brainchild of Patricia Carney down in University College Cork, and Tony Heffernan, who's based in the Mallow Primary Healthcare Centre. So we have other members of our research team who are also based down in Cork, so Dr. Sheena McHugh, Dr. Janice Harrington, and our postdoctoral fellow who's based down there, so Karen Matvienko-Sakar. So here in NUI Galway, we have co-applicants Dr. Molly Byrne, Dr. Caroline Heary, and Dr. Adele Doherty. We have a number of collaborators who are also based in NUI Galway, so Colette Kelly and Jenny McSharry, and then myself and Dr. Michelle Quealy, who have been the ICE Fellows on this project, and also our PhD Spear Scholar Marita Hennessy, who works on a similar but separate project in the area. So in Trinity College Dublin, then we have Professor Catherine Hayes, whose background is around implementation science. So really, I think the key with the Health Research Board ICE Award is that it's this idea of interdisciplinarity. So that we're all bringing different perspectives with multiple angles to try and address this problem. So the aim of the award was really about developing, evaluating and implementing an intervention to improve childhood obesity in Ireland. And during the course of this development work in the initial stages, we developed a collaboration with the HSE National Healthy Childhood Programme and the Nurture Programme. So Dr. Phil Jennings and Anne Pardy, who you can see there. And really this has been key in terms of ensuring that what we do as a research study makes sense and is in line with what's happening on a policy level and on HSE level. So just a bit of a shout out to our International Steering Committee and our collaborators who have been really, really helpful in terms of helping shape what we've done and advise and give input into this. And so again, these have come from a variety of backgrounds and disciplines, and also have included academic, policymakers, practitioners, and really trying to kind of get as much perspective on our project as possible. So in NUI Galway, our ICE fellow Michelle Quealy her specific focus really has been about the health economics side of things, and so her specific focus really has been about looking at the economic costing and evaluation of the intervention. And so Michelle is no longer working specifically on this project, but she continues to be involved in terms of shaping the project from the economics point of view. Down in University College Cork, Karen McFionn-Sakar, who comes from a health psychology background, and Karen's specific kind of focus on the project really has been about designing, piloting and evaluating the intervention with a focus really on the parent side of things, so involvement from parents and what's needed for changing their behaviours or how that works. So then myself, so my background is physiotherapy, but also implementation science. So looking at how can we get research into practice, and specifically looking at healthcare professionals. So how can we change healthcare professional behaviours to change patient behaviours, and really looking at the implementation aspects of the project. So long term, what's going to be viable in terms of fitting into existing care, or I suppose with the existing care or existing policy. So looking then specifically at childhood obesity in Ireland, so childhood obesity in Ireland is a really big problem. So the most recent data that we have from the Growing Up in Ireland longitudinal cohort study has shown us that 1 in 4 children in Ireland is overweight or obese. So this is really a somewhat startling statistic, but also an indicator that we really need to start changing this. And the reason that this is so important is because we know that childhood obesity has serious consequences on a health level, but also psychosocial level and an economic level, and both for the person themselves, but also for people around them, and also for the healthcare system itself. So childhood obesity is associated with a number of increased risk of adult obesity, which is associated with the development of certain types of cancers, heart disease or type 2 diabetes. And we know that obese children are more likely to become obese adults. And unfortunately, this means that childhood obesity can track into adulthood, and that a rapid growth in infancy is associated with increased adult adiposity and obesity and increased cardiometabolic risk. So we know that early life is important. We knew that anyway, but in terms of childhood obesity, there are a number of different factors, early life factors that have been associated with an increased risk of developing childhood obesity. So these have been things like maternal pre-pregnancy overweight, smoking during pregnancy, high infant birth weight, and rapid weight gain. So we know that these factors have been associated with an increased risk of developing childhood obesity. So apologies, that bit of text is cut off at the bottom that says the role of infant feeding behaviours. So specifically looking at the role of infant feeding behaviours, there have been a number of modifiable infant feeding behaviours or practices that have been shown to be linked with poor nutrition and excess weight gain. So these have been things like inappropriate food choice or inappropriate weaning practices, so like inappropriate food choices, but also early introduction of solid foods or cow's milk, or choosing food that's been high in sugar or high in fat. And while the evidence on the protective effects of breastfeeding is by no means conclusive, data from a nationally representative Irish cohort showed or suggested that breastfeeding in excess of 13 weeks reduced the risk of obesity onset at 9 years. So I think the key message here is that there are a number of behaviours, and behaviours means then that they're potentially modifiable, a number of things that we can potentially modify in an attempt to try and change this. So in terms of what's currently recommended, the current infant feeding recommendations in relation to breastfeeding is that breastfeeding should be exclusively breastfeeding until 6 months or 26 weeks. And then after that, that breastfeeding can continue as a complementary feeding mechanism up until 2 years plus. But that really the key thing here is that after 6 months, breastfeeding alone is insufficient. So in terms of complementary feeding then, the guidance would say that from 6 months on is when complementary feeding or weaning onto solid foods should be introduced, but that it's safe to do so from 4 months. So again, the key being that weaning should be timely, adequate and appropriate, and that it's not before, shouldn't be done before 17 weeks, but shouldn't be done after 26 weeks. So that window of opportunity for starting to introduce solid foods. So at present, the recommendation for the age of introducing solids is the same for both breastfed and formula-fed babies. But the exact timing of when solid foods are introduced depends on each baby's nutritional and developmental needs. So each baby will show different or varying signs of readiness. So for example, showing more interest in food, or beginning to reach out for foods, or being able to sit up with some support, or chewing and dribbling. So these types of signs are what the baby will show in terms of being ready for solids or not. But again, the key thing being that they're not introduced before 17 weeks and they're not introduced after 26 weeks. So unfortunately, current practice in Ireland and current data would suggest that 23% of infants are weaned onto solids at less than or equal to 3 months. So by 3 months, 23% of infants have been introduced to solids. And at 4 months, this is 13.5%. So by the time that they get to 5 months, 47% of infants in Ireland have been introduced to solids. So this is quite a good bit away from what the recommendation suggests should be happening. So what can we do to change this then? I guess really looking at, again, this being a modifiable practice, we know that pregnancy and the early years makes a strong case for pregnancy in the early years being a critical window for tackling childhood overweight and obesity. And already we know that there are some interventions that show potential promise in terms of improving diet and parental responsiveness to infant cues. So that interventions that aim to do this have shown some potential promise. So we also know then that interventions by healthcare professionals in primary care have been advocated both in Ireland and internationally. And within an Irish context, I guess all of this comes at a time when there is potentially greater focus, or there are policies and things happening that improve the chance to do something here. So, for example, the National Healthy Childhood Programme and the Nurture Programme. So there's the quality improvements. So the Nurture Programme is part of the National Healthy Childhood Programme, and it's a quality improvement programme funded by the Atlantic Philanthropies. So it's really about trying to develop a better child health service for children and their families, with focus on 3 key elements, so being support, empowerment and education. So it looks at a variety of infant and well-being health topics, so more than just nutrition, but also infant mental health and safety. But really one of the main things that they identified was that there are 25 primary care contact points, ranging from antenatally up to 3 years of age, and that these contact points are potentially valuable times for the healthcare professional to intervene or to try and influence behaviours. So with primary care in mind, and again, this is something that would have really, I suppose, been part of the original plan for CHErIsH. So when Mallow and Tony and Mallow was working with Patricia at the start in UCC, this idea of potentially using the free universal vaccination programme as a time point to do something, in that these are standardised points of contact. There's an approximately 95% uptake of early childhood vaccination, so it's got a good potential reach. And also the fact that primary care practitioners are an important source of information for parents, and there are a lot of conflicting sources of information. So primary care practitioners are an incredibly valuable source of information. So with all this in mind and what we just spoke about, I guess this kind of paves the way for this idea of some sort of opportunistic intervention. So potentially using doing some sort of a brief intervention at the vaccination visits. So you'll all be familiar with the vaccination schedule. So again, just highlighting this idea of these standardised points of contact, where parents with a child who is potentially not sick at the time comes into contact with the GP or the practice nurse. However, there's obvious pros and cons to this. So the pros would be the fact that, as we said, there are high attendance rates, that it's something that's trying to utilise existing services as opposed to trying to kind of build on top or overwhelm or by adding something completely new in. and also the fact that the child is attending at a time that they're not necessarily ill, so they're not attending for another health reason. The cons then, on the other hand, parental and infant distress, so are they stressed about the vaccination? If you're trying to do something after you've vaccinated them, with the child screaming potentially, would that be a good time to be trying to deliver extra information? So would they be distracted? Also then for the practice nurse or the GP themselves, is it an additional time burden for them? Is this something that they just wouldn't be able to fit into the vaccination visit? And also looking at the fact that infant feeding is only one aspect of childhood obesity prevention. So is it worth investing in this aspect of it? So I guess with those pros and cons in mind, we really reflected on this and the fact that childhood obesity is a complex issue. So on the right, we can see the ecological model of childhood overweight, and really this notion that there is so many different components that have the potential to influence the development of childhood obesity, with infant feeding only being one bit of this, so one key piece. So child feeding practices here and on the left. So we know from the literature that multi-component interventions are most likely to be effective. However, we still felt that there's value for looking at whether we could develop better evidence for one piece of the puzzle. So looking at improving infant feeding behaviours, if this could be done, that it may contribute towards the overall picture, and that could potentially be one key important piece of the overall jigsaw puzzle. So with that in mind then, the CHErIsH study was born. So the project aims to do 4 things. So to describe the burden of overweight and obesity in Ireland, childhood overweight and obesity in Ireland, to compile information from existing studies on the influence of infant feeding practices and behaviours on obesity in children, to increase our understanding of infant feeding practices in Ireland and the ways that we might potentially be able to change these, and then to develop and test an intervention to increase guideline-based infant feeding practices with an overall goal of improving childhood obesity outcomes, and also to calculate the cost of doing something like this for the healthcare service. So with these aims in mind, we set out 3 packages to be completed across the 3 years of the project. So work package 1, really looking at establishing the evidence base for the burden of childhood obesity and the role of early dietary interventions. Work package 2, which was about developing a pilot intervention to influence early feeding practices. And the third aspect of this being implementing and actually evaluating the pilot intervention itself. So within each of these work packages, there are a number of different and smaller concrete work components and projects. So looking at the obesity, the cost of obesity, but also trying to pull together all the evidence that exists in all the original studies, both quantitatively and also qualitatively, to look at really what types of interventions may have the potential to work. So the next bit then has been about really trying to find out about the feasibility of this. So what do people think? So the parents who will be involved, the healthcare professionals who will be involved, what do people think? Is this something that potentially could work or maybe not? And finally then actually running the pilot testing itself. So this is where we're currently at. So looking at what we did a little bit more in depth. So in terms of reviewing the literature, we conducted a systematic review of healthcare professional delivered infant feeding interventions with 3 main areas of focus. So looking at how effective these interventions are they based on theory, and were these interventions actually delivered as intended? So is the data that we have, is it accurate? So we also looked at then qualitative studies, so reviewing all the qualitative studies that exist in terms of parents' experiences of complementary feeding and weaning, and also looking at healthcare professionals and parents' experiences of infant feeding interventions. So these types of programs and people's views of whether they work or what types of things can influence how they work or not. Getting input, so then this was really a key part of our year 2, was getting input from parents and caregivers. So we did focus groups with them, really to look at the content, format and delivery of what we would do, and also the potential of these vaccination visits. So we didn't want to just develop the vaccination visits if they were never going to be feasible or practical from the outset. So this was a key piece of what we were trying to find out, was what did people think of this as an idea. So secondly, then again, focusing on healthcare professionals. And so we did a number of interviews with practice nurses, GPs, public health nurses, dietitians, and community medical officers to, again, really try and get people's opinions on addressing infant feeding in primary care and how this should be done. And also then specifically looking at the vaccination visit idea. So what would be the barriers and enablers to doing something like this? So as well as conducting research, we also set up a patient and public involvement group, which Michelle Quealy, our postdoctoral fellow, led on. And this was really about getting parents and members of the public's input in terms of the broader side of the project. So things like outcome measures or data collection, or how we would go about doing the nuts and bolts of this. So what did our development work show? So in a nutshell, I guess, and we do have papers that have been published as well as blog posts and different aspects of our projects. So if you're interested, do get in touch and we can send you on those papers. But in a nutshell, we found that a brief intervention during vaccination visits could work. So there was a bit of mixed opinions on this, but in general, it was felt that it could work, but there needed to be I suppose, a focus on different aspects. So clear, consistent messages and advice. So whatever would be developed, it was really important that the messages given would be consistent with what's already being given and consistent with national policy and consistent across the different providers. It was really important that this intervention would include or would address practical tips and solutions and practical guidance and instruction, and not just, I suppose, more about theory or more, information giving, but really trying to look at practical solutions and including responsive feeding, so how to recognise infant cues and that type of thing. This idea of suitable and trustworthy resources for both the healthcare professional and parent came across. So in that both the parent and the healthcare professional are potentially, I suppose, have come across conflicting sources of information or information that they're just not sure if they can trust. So this, the importance of having something that they could trust and that was appropriate for them to use. And also this, again, the relationship between the parent and the healthcare professional provider, that this would be a supportive, trusting and non-judgmental relationship. And again, this idea of the environment for the intervention needed to be a supportive environment. And this was both between the healthcare professional and the parents, but also between the healthcare professionals themselves. So this was a supportive environment for the intervention in order for it to be effective. So looking specifically then at the healthcare professionals, it was really important that whatever was developed was was sensitive and cognizant of the time demands that exist in primary care for the GPs and practice nurses who would be delivering it, and also of their capacity. So whether it was, I suppose, ensuring that they had sufficient capacity to do this. And also this idea of the role, so clarifying from the outset whose role, which healthcare professional would be expected to be involved in what they would have to do, or whose responsibility that it was, and the clarity around this being really important. And then finally, looking at infant feeding over time, so acknowledging that it is a process that changes and that guidance that is maybe suitable at one stage mightn't be suitable later on. So, and that this resources and the support that would be there would be sustainable across this also. So based on this intervention development work and based on the evidence that was out there, and working again closely with the National Healthy Childhood Programme, we developed an intervention to consist of essentially two levels. So the first level being the parent level intervention. So this being a brief clinical intervention consisting of brief verbal infant feeding messages that would then be supported or supplemented with supporting materials and trustworthy resources. And that this would be delivered at the routine 2, 4, 6, 12, and 13-month vaccination visits. And again, this is where we tied in to the Nurture and the HSE National Healthy Childhood Programme resources to make sure that these resources would be consistent and similar and potentially the same resources. So the second thing then was the really important bit about supporting the healthcare professional to do this properly and to do this I suppose in a supportive way, so developing the implementation intervention. So this was and is being done by the development of incentivized training, so training for health providers that would also deliver them CPD points, so external CPD points. And again, the fact that they would have access to these supporting materials and trustworthy online resources. Trying to help them in terms of memory by setting up electronic delivery prompts, and also then this idea of building awareness on an organizational level, so that there is an awareness within the clinic or the practice that this thing is going on and that there is a general support for it. So trying to address the kind of maybe the more broader factors that might influence whether a healthcare professional could be able to deliver it or not. So at the moment, we're currently piloting this for feasibility in the Mallow Primary Healthcare Centre, so looking at whether this is feasible. So the next steps really, so as I said, this is where we are. We're looking at this intervention at the moment in Mallow in terms of whether something like this is feasible, both to the parents but also to the healthcare professionals who are going to be delivering it. And once this is, I suppose, the next stages after this would be that if it is feasible, then we'd be looking to see, is it effective? So this would be the next steps through clinical trials, so a pilot randomized control trial and a full randomized control trial. And this is really where we'd be asking for your help and for your involvement in this. So through the Primary Care Trials Network Ireland, we would be looking to identify a number of different sites who might be interested in or willing to be involved in something like this. So actually after the webinar, I'll send around, or I'll ask Nikita to send around just a bit of an expression of interest form, so that if you were potentially interested in being involved, it would be great to get your details so that we could follow up with you at a later date if needed. So with that in mind, get in touch yourself. So we're always available to talk, so you can either get hold of us through our individual emails or through Twitter. We also have a study website, CHErIsH.com, as well as a Twitter handle, and you can most certainly follow us or contact us that way. So as well as our website here on the left, we've also our Twitter handle, as I said. We also have a Facebook page, so you can keep in contact with us or keep up to date on different papers or different projects that we're involved with or doing. And then just a list, I suppose, of some further resources or information on this. Potential resources that we'll be using as part of the project, but for your information also. So I'd like just to thank you very much for listening, and hopefully if you've any questions, you can feel free to get in touch with me or through Nikita or directly with the CHErIsH study. So thank you very much.
Thank you, Elaine. That was absolutely fascinating talk, and there's certainly great scope for a lot of impact with this study and improving childhood obesity. Thank you again for giving your talk and coming to speak in our webinar. Our next webinar will be on the 6th of November with Jackie Fox from NUI Galway. She's an occupational therapist who will be speaking about anxiety and stress in primary care, supporting recovery by redesigning daily life. And CPD points and certs will be sent on, and any feedback is welcome. If you have any questions at all, please get in contact with me or Elaine, and this webinar will be up on the website with all those links and resources that Elaine has at the end of our webinar. So thank you again, Elaine, and bye everybody. Thank you.
Bye.